Testosterone in training, doping, and bodybuilding. Effects, substances, and risks. In this second part, we dive deeper into how testosterone is used and sometimes misused in training and bodybuilding. We'll explore the synthetic versions, how they work, why some seek them to build muscle, and what research says about their effects and risks. Whether you're training naturally or curious about how doping affects the body, it's important to understand both the science and the consequences. Test tube: what happens when testosterone is used for training or performance? When testosterone is introduced into the body in higher than natural doses, several things occur. Protein synthesis increases, muscles grow faster. Recovery time shortens, more intense and frequent training sessions. Nitrogen retention in muscles increases, fuller, stronger muscle mass. Red blood cell count rises, improved oxygen transport and endurance. Mental drive and focus intensify. Some report greater confidence and motivation. That's why some athletes and bodybuilders use synthetic testosterone or its derivatives as a performance-enhancing substance. But there's a dark side. Syringe: common synthetic testosterone compounds used in doping. Here are some of the most widely used in strength training and bodybuilding. Testosterone enanthate, long-acting injection, typically used in 1 to 2 week intervals, builds strength and mass quickly. Testosterone cypionate, similar to enanthate with a slightly longer half-life, popular in the US. Testosterone propionate, short-acting, requires more frequent injections, faster results but more administration needed. Sustanon 250, a blend of several testosterone esters, provides both fast and slow release, used for more stable hormone levels. Light bulb: some users combine testosterone with other anabolic steroids in so-called cycles, alternating between use and rest periods to try to prevent the body from shutting down its own testosterone production. Scales: benefits of testosterone use in bodybuilding, according to users. Rapid increase in muscle volume, improved endurance and strength, reduced muscle soreness and faster recovery, increased motivation and self-confidence in the gym, lower body fat percentage in combination with diet and training. However, these benefits are temporary and the price can be high. Warning: risks, side effects, and long-term consequences. When synthetic testosterone is introduced, the body's own testosterone production decreases or shuts down completely. This can lead to red, physical side effects. Testicular shrinkage: the body believes it has enough testosterone. Gynecomastia: male breast development. Excess testosterone can convert into estrogen. Acne and oily skin, especially on back and shoulders. High blood pressure and cholesterol issues. Increased risk of heart attack or stroke. Liver stress, especially with oral steroids. Red, psychological side effects. Aggression, roid rage, mood swings and depression. Addiction, both mental and physical. Sleep disturbances and anxiety. Brain: what does the research say? Scientific studies have shown that long-term use of high doses of testosterone can permanently damage the body's natural hormone production, increase the risk of cardiovascular disease, infertility, and mental health issues, negatively impact liver function, especially with oral use. A major study published in the Journal of Clinical Endocrinology and Metabolism found that anabolic steroid users had smaller heart volumes, reduced cognitive function, and higher anxiety levels even years after stopping. Weightlifter: why do some bodybuilders still use it? In the competitive world where aesthetics, muscle mass, and symmetry are rewarded, some feel they can't reach the top without doping. Black stop sign: legality and ethics. Clearly state that all forms of anabolic steroids without medical intervention are illegal and unethical in most countries. Speaker: conclusion: this is an educational video, not an endorsement. It's important to understand that this video does not encourage the use of steroids without medical supervision. The goal is education and awareness, especially for young people facing influence in gyms, on social media, and in fitness culture. Building strength and health should be done naturally, sustainably, and long-term, not at the expense of your body and your future.